Hello everyone, can you hear me?
Yes.
Hello, can you hear me?
Yes, Amir, we can hear you.
Yes, how are you?
I'm fine, thank you. But your sound is very low. I don't know why. Is my sound system is low or is Sami there? Sami Saleh?
Hi, morning, Amir.
Morning.
Morning, everyone.
Is everyone hearing clearly? Because on my side the volume is a bit low.
Is it? Okay.
Yeah, it's clear.
Okay, right. So Sami Saleh is the first one who cleared his FRCPath yesterday and very happy. So he will kindly share his experience with us. If you have any question, ask him before he run away. Over to you, Sami.
Yeah, I actually met just few. I'm both called guys, so I thought I might write some stuff in PowerPoint just to make my talk a bit focused. So just let me share this slide if that, and I also sharing some kind of feedback from my previous attempt. So yeah, give me a few seconds. How can I share the slides?
If I
Yeah.
stop sharing
Oh,
and
yeah.
then
Okay.
do you have the share screen with you or not? I'm sharing the full screen now, so I will show you where is the screen. This, can you see this one?
Yeah. Okay.
So I will stop sharing, then you can share your slides.
Okay. Right. Yeah. So first of all, thank you, Amir, for giving me this chance to share my experience. So I didn't plan to make it a kind of formal presentation, but since I'm just post night, I thought this might be a bit, useful. So so my aim is just to share my honest reflections that might help others, especially those doing the exam for the first time, or anyone who has attempted this exam before. I have been there myself, so I failed this exam last time, and I just want to show how I managed to turn failure to kind of success. So last attempt, is it spring? So I failed all day two papers. So I failed the coagulation paper and transfusion, and the transfusion was the worst kind of outcome. With 7 out of 8 question, I failed. It was hard, but that failure helped me understand what the exam is really testing. So this exam mainly is testing it's not testing your knowledge really. They just looking for short answer, structured answer, clear answers with key buzzwords. So the examiner are looking for these words. So the answer should be very clear, because I believe anyone passed or cleared part one know hematology very well. So what was like went wrong before? I wrote, so in transfusion especially, I wrote too much details, even used like for those who are doing this for first time. So in the day of exam, they will give you kind of envelope. Inside that envelope, you will find two answer booklet, and that envelope will be kind of located under your candidate number. So you can use whatever you want, and if you want more answer sheets, they can provide as well. The booklet is really massive, big one. So I think one booklet per each exam or per each paper is more than enough. So in transfusion, I've used uh, the both answer sheet or both booklet. So that means I wrote too much details. So my answer was quite comprehensive, include a lot of details, a lot of things. So cover most of the topic, which was, has been asked. So so the feedback. So if sadly if you fail the exam, you will get like kind of feedback, candidate feedback. So the examiner will put like a comment why you failed that question. So the common examiner comment in my feedback said irrelevant material, insufficient details, or didn't address the question. So I realized too much writing doesn't mean more marks. So for example, here, as you can see, this is a coagulation feedback. So here you can see my coagulation paper. I think this. So I passed 5 out of 8 questions. So the coagulation paper has 8 questions in total, and transfusion similarly 8 questions. For each paper, minimum question to answer to pass is you need to pass 4 questions. So here I passed 5 out of 8, but still failed overall because again they also need you to pass the overall score. So I scored 86, but the pass mark was 86.75. So the college used something called Angoff scoring. I think it's the same thing for part one as well. So my understanding, that's based on average performance of all candidates, around 50%. So I asked one of our consultants, he's examiner. So I asked if that mean like the college usually or always like need just 50% of the candidate to pass the exam, but he said no, that's not ideal. But if you like go back and check the pass rate for the in the college website, it's always around 50%. So I don't know. I just believe the college always just want 50% of the candidate to pass the exam. So on the other side, so the transfusion was the worst part. So here I failed 7 questions out of 8 questions. Only passed 1 question. So you can see this. So by each question, I'm not scoring 0. Like that means there is knowledge, but I didn't put down in the way the examiner need to see it. So again, it is not about knowing or not knowing, it's how you put your knowledge on the paper. So after having, when I received that result and the feedback, so I try to approach as many consultant and approach kind of consultant who are linked to the exam or involved in marking. So what they explain that the paper are marked quickly by a volunteer consultants. So all examiner or consultants who are involved in marking, they are not kind of the college will not pay for them, and they are looking for specific key phrases, not essay or details or anything like that. If you throw too much information at them, your key points get lost. So if the question asks for one fish, don't give them the whole ocean. So I reached out as many consultants as I could. So this is what I did in this attempt to try to seek for help. So I practice time question, and some consultant kind of sending if some consultant, they got like kind of question bank, so they share that question bank and or question or scenarios or whatever, and they then I will email back, and every consultant give different insights and feedback. So by time I changed my approach, and I got a lot of kind of tips, and also the here session with Amir also, he kind of filled all the gaps. Amir is doing usually alternate weeks coagulation and transfusion, which was my main weakness. Sorry, so that was really helpful. So this time I spent more. So when I attempt, so in the exam day or when I receive the question paper, I spent more time reading the question than writing. I highlighted the sub question within each scenario. So I think now in the exam there is trend of in the question you can have kind of different scenarios. So that happened in the coag and transfusion. So I think 2 or 3 questions out of it, there was like a different scenario within that question, like different context, different topic, as if like you're covering 4 or 5 topics in just one question. So that was quite lengthy and take a lot of time to answer. So again, that will make you under pressure of time, because the exam time is around 2 hours, and 8 questions that mean you need around 15 minutes per each question in average to finish the exam comfortably. So you need to put that in mind, and the answering technique should be really focus on that. And some questions, the sub question, I mean, in the same scenario, has kind of hidden or sub question within the same question. So I try to highlight all questions just and read it carefully to see if there is any additional information requested underneath that question, and then okay, and put like numbers or letters or anything, just to make me focus when I answer. I need to answer that point, so I will not miss any marks. So to summarize this experience, so this exam is not testing whether you know hematology or it's testing whether you can present that knowledge clearly, like a consultant. If you failed before, don't get discouraged by failure. Use it to refine your approach and practice practice in a structured way, concise answer, seek feedback, and cover all component of the exam. So if anyone here failed the exam before, yeah, don't just concentrate and focus on that part you failed. Try to balance. Still, you need to balance everything, every part of the exam. I think that's all really. So thank you again, Amir, and to all colleagues. I hope my experience helped at least one of you to avoid my mistake. Thank you.
Thank you, Sami. Anyone has any question, please shout out.
Sorry,
Thank
hello.
you so much.
Just needed to ask a small question.
Yeah.
Yeah, you told us you had an envelope with two answering sheets. Then you write your name and your number on the sheets, or what's this point? How it works?
Yeah. This part, Amir will cover all the logistic and all the details of the exam. But anyway, the yeah, two answer sheet inside the envelope. So in the first page, you need to write your candidate number. No name in this exam need to be written. So only candidate number, the whole exam.
Okay.
Each part of the exam, yeah. And then which part of the exam you are testing in this answer sheet, and is it the and also if you need like more than one booklet, also you will write it down that you use two booklets, so the examiner will know.
Okay. I write where that I use two booklets.
Yeah, there is question like that in the first page of the answer sheet.
Okay. So it's all about questions already written and we answer.
Yeah.
Okay. Thank you.
Any other
Assalamualaikum,
question?
Dr. Sami. Yes. First of all, thank you so much and congratulations a lot. Seems you worked hard. My question is that what about the morphology, difficulty level, short cases, long cases? Viva, I heard it's easy for all of in all parts, but for morphology, if you can guide us.
Okay. Morphology again, I think the whole exam, I guess that the timing is the main issue. So practice again. In terms of morphology, what I did, we have morphology teaching in our hospital. So some consultant got like kind of first block of slides, mainly to help the exam. So we'll cover whole part of the exam. If you are working here in UK, you can ask. So I'm sure each hospital has one of those consultants who like morphology. So approach those consultants and yeah, definitely they might help. So additionally, there is a lot of resources for morphology. Yeah, virtual microscopy has a lot of slides, over thousands, and and also Amir is doing alternate morphology session as well. So yeah, so that's collectively make the morphology easier. So it's not, again, the answer technique again is not about knowing what is the diagnosis. There is a lot of things in morphology you need to know. Buzzwords you need to mention. If you didn't mention that phrases or word, you will not will not get the full mark, or yeah, you will be. And if you mention something irrelevant or anything, especially kind of in life-threatening condition or emergency, and you miss that, so definitely I hear there is no negative mark, but my feelings those if you answer something very silly in life-threatening condition like APML or TTB or something like that, yeah, definitely will not pass that question, whatever you write.
Did they mention negative marking on the top of the paper?
No, there is no negative mark, but
No,
as
there is some.
there is.
Yeah, on the transfusion paper, they mentioned that you will be negatively marked if you answer irrelevantly.
Oh, okay. Yeah, it's okay. Thank you. Seems like I didn't read that paper.
Yeah, no, well, you passed. Congratulations. That's all what it matters. Congratulations.
Thank you, sir. Thank you. Uh,
Anything else from anyone?
Can I please ask a question?
Yes, go.
How much should we focus on trifines and lymph nodes? Because usually we don't get to do them in day-to-day practice.
Yes, Sami.
so this time we got Trifine, I think. Just one slide. For Trifine per se, you need just to know the basics. You don't need to go deep and know everything about Trifine. So again, approach any histopathologist in your hospital. So the basic about describing the Trifine. So the examiner just want to know that you look at slide with Trifine slide before, and also that also a reflection that you are attending the MDT, because if you attend any lymphoma MDT, the histopathologist usually talk about same things: cellularity, abnormal cells, description of those cells in Trifine. It's a bit slightly different than the aspirate. So yeah, it's you don't need to do kind of very comprehensive cover for the Trifine. I attended Cambridge Morphology course. It was excellent course for morphology. It covered all parts, everything, and a good refresher if you are not exposed to morphology that much in your hospital. So 1 day or 2 days, sorry, yeah, we'll cover everything, including Trifine or whatever in aspirate and other parts as well as like parasites. Additional resource, which is quite important, if you can approach the BMS biomedical scientists in your lab and check maybe last year Nickwas slides, because Nickwas slides are the same resource for this exam, so it will be the same question. Some Nickwas slides, to be honest, are so difficult, written by Barbara, and so rare conditions. Don't worry about those. Just the common things which day-to-day activity, mantle cells, CLL, these kind of things are there in Nickwas, and also there is parasite Nickwas. So if you talk to your BMS, it will give you kind of Nickwas slide for the last 4 or 5 years. Just do the 1 or 2 years. That will be a good refresher. Do it just near to the exam, like 1 month before the exam will be really good.
Thank you,
Okay.
Sami.
Yeah, all the best, guys. I will pass to you, Amir. Thank you.
Thank you. Lashani, do you have Lashani on the list?
Yeah.
Yes, please go on.
Yeah. This is so the FRCP part 1 and part 2 were my first UK exam. So anyway, I managed to get through both during my first attempt. So this is not very difficult exam, but we need to work very hard. So I started my preparation for part 2 about 6 months before the exam. And first, I prepared 4 folders for main 4 topics: coagulation, transfusion, general hematology, and hemato-oncology. And then I downloaded the topic list from Hemebase, and then I started reading around those topics and making notes. And then at the same time, I joined a small discussion group. So we discuss past questions and important topics once a week or sometimes twice a week, about 2-3 hours per day. That was very helpful because some points I realized that I didn't understand correctly, so my friends corrected me, and when I answered my questions, they actually criticized, and they gave their opinion, which was very helpful. And also I joined Hematomorph from the first lesson. That was very helpful because I practiced my answers under timed conditions. So timing is very important in the exam. So Hematomorph was very helpful to practice that. And also Dr. Amir guided us what to write and what not to write for the particular question, because I used to write a lot of irrelevant things, and initially I couldn't manage the time, but later with practice I was able to manage the time. And also morphology sessions were also very helpful. And as my colleague told, so I initially chosen a microscope because in our center we can borrow a microscope from the hospital. So I used the same microscope to practice all my morphology. So what I did was I got 2 years NICOA slides from the lab, and once a week after 5 o'clock, after finishing my work, I spent like 1 hour or sometimes 2 hours to report the NICOA slides, and then I compared my answers with the NICOA's report. And then about the resources, I hope you already know about BCSH, how I treat, and also Hemebase, and also the textbooks, Hofbrand Postgraduate Hematology and Hemoglobinopathy by Barbara Brain. I didn't read all these books from the first page to last page, but when I get a question, then I used to go back to the book and read. And also I did mock exams, Dr. Visha's mock exam and Dr. Amir's mock exam, and Dr. Andy virtual microscopy also has mock exams. So I did all three, and to be honest, I didn't score very good marks in the mock exams, but those were very helpful to identify my weaknesses, and then I managed to correct those weaknesses. So I would recommend you all also to do the mock exams as much as possible. And also I did NHSBT transfusion course, and also there is a very good coagulation course in Blood Academy. And yeah, that's all. I think we all have the knowledge, the same knowledge, but exam is just practicing the exam techniques, and I think that is the key to pass the exam. Yeah, and I want to thank Dr. Amir for your guidance and support. Yeah, good luck, everybody.
Thank you, Oshani. Any question for Oshani? Oshani, how much time did you take for preparation of part 2? And what was the interval between part 1 and part 2?
Interval between part 1 and part 2 is 1 year. And I started preparing for part 2 about 6 months before the exam.
And do you work in UK or outside? You are outside?
Yeah, I work in UK.
Hussam has a question for you.
Thank you. Thank you for input, and it's really helpful. My request is, can you share your big folders?
Sorry?
Can you share the 4 folders you have for each, you made for each specialty? And you said you made a folder for each
Yeah,
topic.
but those are hard copies, you know,
Oh,
not
okay,
soft
okay.
copies.
That's fine.
Yeah.
Fine. Thank you very much.
Sorry.
Don't worry.
Hello, hi. Congratulations for everyone.
Thank you.
Just needed to ask you, is Heme-based not sufficient in addition to the course of Amir?
Sorry, Heme-based has
I mean, I feel like Heme-based is already we have all knowledge mostly, and together with the course of Amir and some Blood Academy courses is not enough. You feel it's not enough because I hear like you did other lot of work.
you are asking whether Heme-based is enough or not, right?
Not only Heme-based, but Heme-based with Blood Academy and the course with Amir, I think more than enough. Is it an impression or what do you think?
Because I have like about now 8 years experience working in hematology. So I had the background knowledge, and with that background knowledge, I think it is enough. But sometimes I had to go back to books and guidelines to filling the gaps.
Yeah, sure. Always there is gaps. Yes.
Yeah.
Okay. Thank you.
Yeah. I don't have a course. I have weekly sessions, Padwa.
Sessions.
Yes.
Sorry.
These are Sunday sessions and not a course.
Sessions. Yes. Okay. Sorry.
Sayyid David, do you have a question?
Yes, Lashani, congratulations. Just I want to ask regarding the courses you attend, Dr. Vishal, and other courses in UK. How should the outsiders access, those who are not in UK? Can we access, and can you share some links so that?
Dr. Vishal's mock exam is in-person exam, so so I don't think you can do that remotely. But Dr. Amir's mock exam was a remote one, and a virtual microscopy by Dr. Andy is also a remote exam. So I think you can attend those two mock exams, except this Dr. Vishal's one. And I think UCLH one is also in person mock exam.
No, how to approach them, even if it is in person? Like,
So you
is
mean
there a way?
their email? Yes,
Email or
I will share their emails. Yeah, you can send them an email, but unfortunately they are face to face in person. So if you can travel to UK to attend their courses, the Cambridge one, the Vishal or UCLH one, it will be good. They are near to the exam, so if you can plan to visit the UK a few weeks before the exam, then you can attend them. Okay.
okay, great. Thank you. I look forward for your emails. Thank you, sir.
Thank you, Lashani. Enjoy. Right. We will go to Sahla now. Sahla, you there?
Hello, hi morning. Hi Amir. Hi everyone. Yes, so my name is Sahla Ali. I'm ST6 hematology registrar at King College Hospital. Just wanted to give you a few minutes to share my experience preparing for the FRCPath examination, that it might help someone guiding their preparation for the next setting. I am a mother of 3 boys. My youngest is 7 years. So it was a bit tough preparing for the exam and taking the time. So my experiences might be relevant to some of you. I studied actively for almost 6 months, but since I make the decision that I will be appearing in the exam a year before, I was also studying in between. But for the last 6 months before exam, I was actively studying with a group. And yeah, most of the time I canceled my summer holiday. And yeah, I mean, I did give it a good go. So, you know, the FRCPath is not about only knowledge. So we needed to practice also like clinical with my colleague, managing complex diagnostic scenarios with the mock exams under pressure time here with Amir, and some of the courses recommended by some of my colleagues, which I will stress on my own personal view on those courses as well. With regard to the exam, I think the time management was crucial, and I felt I was racing during the exam. The questions, they were quite lengthy and open-ended. So I need to stress that mostly you need to concentrate on practice, on time, because I think this, I found it's really helpful. And as my colleagues, they mentioned to everyone by this time, he had the knowledge, but I think it's just the technique and the timing. And to be honest, my personal view, I feel this exam is not a reflection of all of our knowledge, but unfortunately we need to deal with it. And I expect it will change quite soon. This is what we heard from our consultant. So I can go through each of the pillars separately. For Morphology, I would say I did my first part on spring 23, so it's almost 1.5 years as a gap between my first and second part. I felt really basic about morphology when I started preparing. I know only to deal with the on-calls stuff, but I put like a plan because morphology is a cumulative knowledge, and my colleagues, they have recommended that you need to have like a steady engagement with reporting locally at the hospital. So you need, I think, one of the good things, I kept doing this regular during the working hours. I found it difficult to go through the NICWAS during my working hours, and I had a long commute, so I didn't have a chance to go through NICWAS early. But as Samih said, me and Samih were in the same colleague in the same trust, so we practiced NICWAS very late, like 3 to 4 weeks before the exam. But it was really quite helpful. If you can do it earlier, it will be, I think, much better. I did Blood Academy at the start of my revision for morphology, and I did visual microscopy as well. I think they had a huge source of slides. You can practice to test your knowledge. You can practice to see a couple of slides for the same condition. I think it's really valuable source of information for morphology. And also I did a lab rotation in my hospital, which is usually involving reporting matters independently, and then you will have like a constructive feedback by the consultant. So I think I was more confident in doing morphology because I exposed to it a lot in my hospital, and I had a formal feedback about it. And I joined Amir very early for the morphology as well. I think we were 4 or 5 when he started. So it was really good to practice under pressure when you will be leading the case. But I think it's just maybe I would suggest to have like a time limit as well, because it will be helpful. When there is a stress and adrenaline, you will forget everything, even if you know the case. The courses I attend for morphology, I attended Andrew Wilson UCLH course. It's very organized, very constructive feedback, and he corrected my way of reporting. So I found it's really helpful in morphology. The cases were difficult, but I think it's more familiar with the exam rather than the other courses. He is difficult, but it was more correlating with the exam scenarios. I also attended Cambridge course. I think they have a very organized course. They covered every single aspect of the morphology, and they have an excellent slide for the last minute revision. But comparing to the exam, I think I felt it's a bit easier and straightforward. But I think it's very important, and it's recommended by a lot of colleagues, and I would recommend it as well. If you can make it to Cambridge, it's really helpful. And I did Amir morphology mock as well. And we did also mock at King's. It's organized by our consultant. So I think that overall, it's just the experience of doing this under exam condition, under a time manner as well. And and I think we did it like in less time at Cambridge. Like we practice over 5 minutes, but in the exam, I think it's really with adrenaline. You will feel racing, but you will have the confidence that you have done it multiple times. So definitely, this was quite helpful during the real exam. This, I think, for the morphology. I wanted to recommend as well, if you can have your own microscope. I did it with one of the Amazon version microscope. I used it for the Cambridge mock. So I was confident that I was able to get the right answers. and I took it for the exam. It was really good. So I'm happy to share the link if anyone need it. For the hemostasis and H&T, also I started initially by Blood Academy. All the study was active during the last 6 months. I also studied from Embolus app. I think it has an excellent basis, and they have some rare scenarios. We have one of them in the exam, which I've never seen it elsewhere other than Embolus. And Amir's session was a great consolidation of that regarding the knowledge and the practicing and the focused exam time as well. So I used to join all Amir, most of it, to be honest, and listen to recording if I had the time, and grab a paper and do the practice. Although I didn't share my answers most of the time because my handwriting is it wasn't great, and I had a feedback from my consultant as well. So I needed to work on my handwriting and my spellings. So you need to do it actively rather than listening. We had, regarding the courses, I did a Blood Academy course, which is quite helpful. There are 18 cases, and I did it very early, 6 months earlier. I don't think it will be helpful if you just do it ahead of your exam, 3 weeks. Maybe you can, if you want to repeat it, but yeah, I think it's more helpful if you can do it very early. Part of the USLH course, we did the H&T as well. The practice is excellent, but I think the feedback, I didn't find it helpful. And the most important for the people in the UK, my team at King's, they were quite supportive. We did practice formal feedback, and I think we did 2 mock of COAG as well, for 4 questions each. We had a formal feedback, which is quite helpful from the consultant, what you need to do and what is missed. So if you can do that at your local hospital, I think it will be very, very helpful. And we did also Viva sessions in H&T. Guidelines, most of you, they will know the BSH, the UKHCDO, and some from the ICTH guideline. I wanted to share that I used ChatGPT to summarize these guidelines, and I used it for Viva sessions as well. It's very, very helpful, sparing the time. So just to get the most important points, I didn't use it as a source of studying itself, but I used to take the links of the guidelines and get a summary or get a Viva style questions. And we practice it in the group. So I think you can try that one. I found it's really helpful. What else I can say? I think also regarding the exam, when I was doing the practice, Amir and also my consultant, they focused that you need to do the bullet point rather than writing a full essay, and try, I would say, really this is work for me because I am very slow typist. English is not my first language, and I had lots of problems with the spellings. But I tried to be short, concise, and to the point. And one of my consultants, he said, you need to gain a mark for each sentence you have written. So don't try just to write whatever came in your mind. Just try to grab a mark with every sentence you wrote. When you are practicing as well in real time, just pass on when the time for the question is finished and address question according to their marks. If the question is 6 marks, you need to give an extensive answer. If the question is 1 mark or 2 mark, you need to give a very brief answer. And I think Amir, he stressed a lot about this stuff during his practice. Transfusion, I would say, start early. I was quite scared of transfusion because of the high failure rate and the feedback from my colleagues. So definitely we started practicing very early transfusion. I would say I didn't rely on heme base for the transfusion. I went to the NHSPT guidelines, some of the GAPAC guidelines, and I use ChatGPT as well to summarize these guidelines. You might find it's difficult. I am a busy mom as well, but I think getting the summary of these guidelines, you will feel confident you covered most of the stuff. So when you are practicing, definitely these things, you practice it before, even if you didn't practice it recently, at least you are confident you have gone through the guidelines. I've seen also some of the materials of the transfusion courses before I attended. One of my colleagues, he shared it with me, and I found it's really helpful seeing these and studying it before the exam and before the transfusion course, because I think it's very late. And I would recommend that you take the earliest transfusion course, not the latest one. I did practice Amir's transfusion cases, same, and it's really very constructive feedback. And I screenshot them and I tried to practice them very near exam as well. And also I took like some points about my weakest areas, which I didn't pay attention to during my writing. So I think when you start writing, you will realize the mistakes rather than actively listening. Exam was tough. Very open question in the transfusion, and you need to be efficient and quick. And to be honest, till I left the exam, I don't know what I've done. And yeah, you will not realize this is for me, at least, what they have wanted from you, unless at the time of the result. At that time, I realized probably it's a guess, luck, but I think also Allah's blessing for the reward of the hard study. Courses-wise for the transfusion, I think it's mainly the NHSPT course and practicing with Amir. And I did part of Andy full mock, but also it wasn't valuable feedback from the transfusion. I think Andy mainly, I would say the morphology was excellent. General advice before the exam, I would say take a good rest, take a good hotel. Don't revise the day before the exam, because I think it's a cumulative and you will be, I've seen some of my colleagues are studying till early morning hours. I think it's difficult when you are coming to the exam. It's lots of physical and mental stress. And if you had like a fresh start, you will be able to recall what you have read earlier, interpret it very well, and good guessing. Lots of guessing in this exam. In malignant, I don't think I would recommend anything specific. It was, I think all of us, we have a good experience and practice in malignant, but usually the weakest areas is the transfusion and HNT. Best of luck for all of you.
Thank you, Sahla. It was very nice and constructive feedback. Thank you. We have Chinma here.
I have a question with Dr. Salha. Sorry.
Okay.
Yeah.
Yeah.
So I'm the busy mother also. So I have a question that how you manage the kids' study, job, and everything in per day. How much hours you are giving to the study? As you said, you started study 6 months back, and so how much time are you giving to the study specifically?
To be honest, I studied a lot. I won't lie. I started even before 6 months, individually and with some colleague, but it's like not a regular studying. From 6 months, it was like very regular studying. After coming from the hospital, we do usually start like around 9 sometimes till 11 or 8:30, minimum 3 to 4 times a week. Over the weekend, we attend Amir in the morning. Sometimes we have another studying. Afternoon, we'll take a gap and go back again in the evening time. So to be honest, yeah, minimum of 6 hours a day I was studying. Even on the days where I work, we used to have like a 2 hours study. You need a good support at home as well.
Thank you so much and congratulations.
Thank you.
Dr. Saliha, I also have a request to you. First of all, congratulations on passing your exam and thank you for sharing your feedback. Could you please share that link for microscope that you just mentioned? Could you share that in the group?
Yeah, of course. I will do, yeah.
Thank you.
So I have a question for Dr. Amir and here where I work, we have our lab is associated with ACP, American College of Pathology. So they get their slides. So will this will be similar concept like Nick was, or I have to check? Any idea regarding this?
Slides are
I
universal. Yeah. Yes, go on, Sana.
Oh, thanks, Amir. I think every morphology I used to revise sometimes from Google. So I think it will be definitely some sort of your practice to consolidate your knowledge. And I think Amir, he recommended Nicholas because I think it was the same company producing the exam slides, as far as I remember. But definitely it will be helpful to look as much as you can.
And Atika is saying, can you share question style with Dr. Amir so that he can make them part of his session, especially transfusion and clinical management?
Oh, you mean the ChatGPT ones?
Atika may know. He can shout out.
Assalamualaikum. Congratulations.
Thank you,
I love
Atika.
your efforts. You did a lot of effort, mashallah. No, I'm asking, can you share some kind of the question format you get in the exam, the actual exam?
Okay,
Do
I
you
mean, to be
find
honest, I wasn't aware. I think later I was informed that we shouldn't share exactly what is the
No.
question,
You cannot share the
the actual
the
question.
question, but I think he means the style of the question. It is the same that we are practicing in our sessions. Okay? There is a
Yes,
scenario with
but I would.
sub-questions.
Yeah, absolutely. I think the knowledge is the same, and what we are practicing is the same, but it's a bit lengthy just to let you know, like a simple first question in transfusion. We were given like a scenario, very lengthy scenario with 4 subdivisions for the question. This is part A, and then there is part B as well on the other paper. 14 minutes it took me to answer this question. When I turned the paper to do my second question, I realized there is part B with 4 subdivision under it. So I think it's a bit tricky. It's more lengthier than what we have practiced, but to pay attention as well when you are doing the exam, read the full question, because I thought this is the question because there is 4 subdivision. And I realized later there is a second part for the question. So I was rushing the whole paper because I lost my time.
Oh, thank you.
Thank you, Sarha. Now enjoy.
Thank you.
Denushia, are you there?
Hi. Hello, everyone. I'm not going to talk a lot because I think already my colleagues have spoken with you, like everything, how to prepare and everything. So actually, I'm Denushia. I'm actually from Sri Lanka. My experience would be helpful to the colleagues who's from outside of UK. Yeah. So. I'm working. I started actually. I'm working in a district general hospital, so I don't have access to loads of teaching and things. And I prepared for this exam only for 4.5 months. So the thing is, actually, I have very good background in Sri Lanka in hematology, as my colleague Oshani mentioned. So we have strong background of hematology. So I don't have much experience in NHS as well. So what I have to say is, knowledge-wise, as my colleague mentioned, of course you need to have knowledge, but I think all of you have like lots of knowledge. It's just polishing your knowledge and learning how to apply them in the exam. Like you should not write unnecessary details. Just hit the question and write the like relevant points only. The next thing is practicing. Of course, practicing wise, I'm also a mother of 2 kids, and I just moved the house, and my husband is working far away. So I was like, during 4.5 months of studying, I was working like a machine. Just came home after 5:30, 6 o'clock, and I just started cooking. And after that, I think I started studying 8 o'clock. And since then, until then I work until 1 o'clock or 2 o'clock morning. I'm a late bird, so I can't wake up early morning. Until I'm tired, until I feel sleepy, I continuously work. Like that 4.5 months, I gave totally myself to this exam. And so practicing wise, of course, I did practice a lot. Dr. Amir's course was very, very helpful. I remember I joined that on July. And the first question was so difficult. When I was joining, they were doing a question and I couldn't do anything. I was thinking, oh my God, what is this? What is he asking? What are these questions? But since then, I tried to join his courses, and because like the most important thing in his courses, he's asking us to do it in a like 10-minute time. So exam that 5 minutes time, we need some time to process and things. So exam, it's better to like practice to do things in 10 minutes. That one was very, very helpful to me. Because of exam anxiety during that stress, we can't that 5 minutes will be like gone without like before thinking. So and his questions are also very helpful. There were some questions I never thought. Those questions are very helpful. And always when I get a new question, or when I what I did was, when I get a new question, I always think about all the possible other scenarios, and I make mind maps and things, some answers inside my head. And if I feel like that question is very good, I do write the question. Like if I made it, even though I made it, I write the question and I write the answers as well. Always then and there, I make something. If I find some new details or now new knowledge, and I feel like I might forget it, I write it on a like a special paper, and I make a new folder, kind of a those are don't ask for copies. Actually, they are hard copies. I make a folder for myself that is just before the exam for me to study. So I know that I might not forget those things, like not to forget my new knowledge. I make them, I write them on a paper, and I kept it like just to study before exam. There was a before exam folder. I put them into that one. So like that, practicing, of course, practicing. After joining Amir's course, there were like he has morphology and thrombosis and transfusion course. I try to join everything, but if I miss something, what I did, I next day, or like I did it after when I have time. But I did timed and how all. But I recommend doing them live as possible, as much as possible. And knowledge wise, and as my colleague said, heme based virtual microscopy, those things are also very, very helpful. Heme based is very concise and very nice. It's a very, very good site to refer. uh, Coagulation, I referred that practical hemostasis during back in Sri Lanka. I did everything practical hemostasis. So during this one, I just referred only like only few important things only. Transfusion, of course. I had a very I have a very good basic knowledge of transfusion, good knowledge. So I just polished my knowledge with that NHSPT course. It was really helpful. Morphology wise, of course, Dr. Amir's course is very helpful, and there is by blood academy and virtual microscopy. Blood academy, I don't know, but I felt like the question and the slides are a bit not like going together. So if there's a question that should give us some details about what is it, like once we go through the question, we know what we are looking for. But blood academy, I don't know what other colleagues think. I feel like some questions and the slides are not matching. However, Andy's course is really nice, really helpful. So what I want to tell my colleagues outside outside UK, morphology wise, I didn't go through much in UK. I didn't have time. I'm working in general hospital, so I do ward based care and on calls only. Very few slides. I think I didn't go through slides more than 5-6 days, and that is also only working hours. So only few Nequa slides and just few slides of like blast, like important slides only. That's one thing because of my good background knowledge. So what I want to say is, if you have very good background knowledge, I know most of you have, don't worry about the UK stuff and things. The slides are the same, everything is the same. You will be able to go able to do that. There is no much different. Only thing is the slides are better. Slides are better than what we have in other countries. So, and what else I want to say is, so the exam wise, transfusion coagulation, as the colleague says, again the questions are a bit lengthy. However, if you try to focus on your timing, and if you try to write them in bullet point forms and avoid unnecessary stuff, you will be able to like do it on time. And the other thing, always focus on your time. But if I start doing exam, or like what I always do is I write the time, starting time on my paper, and since after that I carry on that time. If I start at 2 o'clock and the question is 2:10, I write 2:10. At 2:10 I stop it, then I go to next question 2:20. If it is 2:20, I stop it. After that I just carry on. I do not think about what is the next one. Always like before I sit for exam, I find like how much time I have for each question, and then carry on that one. After that I don't go back and do anything, and I do not spend any like a lot time on the second question or whatever if I haven't first completed the first one. And morphology, actually morphology was a bit difficult. What I found in this exam, coagulation, transfusion was okay. Morphology was Viva was okay, definitely okay. Morphology was, the thing is bit I think probably with exam anxiety and the time stress, it was a bit difficult. But the thing is, yeah, of course, practicing wherever you are, just practice, just keep on seeing slides. So yeah, you'll be able to do that. They have like always they make new questions, so there are a few new questions, and whatever you keep on practicing and whatever the things in your spinal level comes out in exam, that's what I felt. The knowledge, like always the core knowledge and the spinal level knowledge, because when you are doing exam, sometimes after coming out of the exam you can't remember the questions even, because from the spinal level you have been working. So practicing is very important. Yeah, during that 4.5 months, even though that is small time, I did work in weekends. I did work, I mean, not work in hospital. I studied during the weekends as well. Yeah, so that was very difficult time, but yeah, of course, yeah. So I wish all of my colleagues good luck in this coming exam.
Thank you, Denusha. There is a question for you. So you do not have UK training or do not join UK courses and just depend on online training of Dr. Amir's sessions and Blood Academy?
Yeah, of course. Courses wise, actually, I did join Dr. Amir's session, and I went to Vishal's course. Definitely, yeah, it was very, very helpful. Of course, the Viva was very helpful. You when once you go through that Viva, you know how to face Viva. I mean, during my first Viva, I trembled, but the next one onwards, I just got the face, and exam was so easy because of this one. And and the other thing is I joined blood academic course, which was blood academic coagulation course, which was really helpful to like fill your gaps in your knowledge. I had like lots of gaps, and then I filled them with all those things. And NHSBT transfusion course, I did that, and that was so. I would recommend do it earlier because it consumed 5 days of your time. It was a marathon, so it is just, if I did about like 3 weeks prior to my exam, so it, even though it is really good, I felt, oh my god, I have lost lot of time for to other things. So I have done only transfusion that time, and after that course I had no energy to study as well because my brain was so full. So I would recommend, if you are joining, join it early. You will not forget, and if you want, you can do some recording as well. So yeah, just try to for join it earlier than like later. And of course I haven't had any other joined any more for anything, any UK training or anything. I haven't had anything.
Sahla has her hands up.
Yeah, just to add to the NHSBT transfusion course, they usually ask at the start of the course if you had any like topics or difficult areas. So when you are studying, you can note down whatever you find difficult and you need to have a more feedback on it. They're very excellent. Getting back to all, they targeted is essentially what we have asked them to do. So I think my group was quite excellent. They covered extensive topics, so everyone experience is different with the course. But yeah, when you are studying, you can note down whatever you think that is you can't understand well, and they will be able to cover it during the course.
And of course, when you thanks Sala, of course, and when you are doing those like studying and things, write down all the questions you get to your mind and think about exam scenarios as well. And when you get a question in exam, think the real scenario. Think, if I get this patient, what I'm going to do then, and that is the answer. You know you have good like knowledge, and don't think about nonsense. Just think, if I'm the registrar, if I'm the consultant, what I'm going to do. No, don't write I'm going to call the consultant, but just think like you are the consultant and just answer, and that is the answer. Just like, and always hit the point what they ask. If you do that, there will not be a problem with timing. And if for all the questions, think about other scenarios also. Think, if they ask like this, what I'm going to write. If they ask like that, what I'm going to do. So you have then you have covered all the possible questions they will ask as well.
Yes, in part 2, you are consultant. Remember this. Thank you, Denushia, and enjoy your day. We will move to Razan Al-Bashir.
Yes, Amir. Hello, everyone. I think I'm not going to add a lot. My colleague has been really thorough, but just to introduce myself, I just started ST7. I work in South Wales in Cardiff. So, and I hope my experience can support and encourage anyone currently preparing or planning to sit the exam in the next setting. So actually, Sahla is my study partner. So my experience is almost the same. Just going through the things that people mentioned, it took me longer to prepare for this exam. I actually did part 1 3 years ago. It was September 2022, and then went out of program for a year for maternity leave, and then I came back with a child. So my son is 2.5 years, and you can imagine how difficult I think to study with a toddler. So I started, I would say, when I decided to do the exam in autumn. So I started early in the year, like January, February, but it wasn't regular, it wasn't consistent. It was like I do half an hour, 1 hour, sometimes once a week, twice a week, but just to put me on the mood. Then I joined the study group, Sahla and other colleagues, and I would say this was the most important thing, because it does help me a lot, and it just guide you, and sometimes you feel really stressed, and you can't just study for any reason. Listening to your colleague, just going through things, that helps a lot. I think, as I said, I've been practicing with Sahla and my colleagues, so my experience is literally very similar. The thing that I would just wanted to say, I think I felt, I'm not sure if anyone has mentioned, but a pathology portal is a very good source as well, as the other, Blood Academy, Heme Base, Amer's website, and his sessions was really very focused, and I used to write down the questions, and even if I didn't attend the session, if I didn't listen back to the session, but it just tell you these are the important topics. So pathology portal is really nice in coagulation. They have 20 long cases, which are really very helpful. And in transfusion as well, they have cases, and in HPLC and hemoglobinopathy. I think that's the only thing I would add to everyone. I know everyone has said all the other sources. The courses I've done, similar to what Sahala did, I did the NHSBT, as everyone does. I did the HNT as part of the Blood Academy. If you are, if you have the Blood Academy subscription, the HNT one, and I did the UCLH, and the morphology was really amazing. I agree with Sahla that morphology is the excellent thing in that course. I didn't find the clotting or transfusion that helpful. The Cambridge morphology course was amazing. I didn't have the time to do a lot of morphology in my hospital. I just did NICWA slides maybe around 3 or 4 weeks before the exam, but I felt the morphology course was really helpful, because you just see everything. Yes, you might feel it's a straightforward cases, and it might be easier than the exam, but also you just go through everything if you don't manage to do it in your hospital. So I think my main advice, I would say, we all have the knowledge. It's just practice, and I would say start with transfusion and HNT, because I know everyone, our main practice is, we see malignant every day in our daily practice. But I would say start with transfusion and HNT when you start to prepare for the exam. Practice under exam condition, time is the main issue in the exam. So I think if you practice in the exam condition with time pressure, and ask your consultant to mark your answers or give you feedback, that's really helpful. And just write bullet point, and my answers were really short. I've never done, I think I haven't completed one booklet for transfusion and even HNT. I see people write, they ask for other booklets, and I was really stressed, like, might not be giving, the right answers. But that's what I just thought. I just feel like there is no time even to write lengthy. Read the question, the whole question first. I would say they are very lengthy, but at least you would know. Especially in transfusion, there's like part A and part B, and in each part there's 4 sub questions. And I know my colleagues, they miss. You can take the 15 minutes just answering part A, and then you realize when you just turn the paper, there's part B. I think, can you hear me, guys? I think I feel like,
Yes.
Yes.
sorry, because I'm just doing it from mobile. So I think this is, yeah, just read the whole question, all parts, and write bullet point. And I'm sure you will make it at some point. It's just when it's the right time for it.
One of the colleague is asking regarding question statements in exam. Were they confusing or tough to understand what they are asking?
To be honest, morphology, I felt morphology was okay, especially the long cases were really straightforward. The short cases were just the time, but you know, you either know the slide or not. I don't think they were confusing. The only thing I say was confusing is the transfusion questions. They were really vague and non-specific. And as Sahla mentioned, you know, until I got the result, I didn't know what I've done in transfusion, to be honest. H&T was tough questions, but you would know what, you know, what exactly is a question, and you know, they were, I wouldn't say straightforward. They were tough questions, but you would know. You either know it or not. The transfusion is a bit vague, but I think NHSBT is the main source, and also I did the mock exams, and they got 3 mock exams in transfusion and coag, which I find it really helpful.
It means that mock exams are very helpful. So all the candidates who are working in UK or outside UK, they should ask their consultant to arrange mocks for you.
Yes, absolutely.
UCLH versus Vishal. For
It's a
all of
question.
you, for all of the speaker, if you have to choose UCLH or Vishal.
I actually did UCLH, but my colleague did Vishal, and we went through things I like together. So I did Vishal for part 1, and it was really helpful. And I think that the people who have done part 2 with Vishal, they also find it really helpful. And I would also agree with that, because when I went through you know, the course stuff with my colleague, they were really helpful. Especially, I think the most important thing, he goes through the past papers. The UCLH morphology was excellent. That's the only thing I can say. But I haven't done Vishal this part. But I think I was thinking if I didn't pass, I might do Vishal this time. But I'm not sure if I would have done it from the first part.
Do you get hint from the question that guide the morphology, like flow and mutations, etc.?
Yes, you do get hints. That's why I say I said go read the whole question, because like in the exam there was a lymphoid question, and I think it was mantle cell. I didn't put it as mantle cell, although one of my consultants was marking the exam and he said this is mantle cell after the marking. But they say the patient has cervical lymphadenopathy. But when you look at the slide, it does look like actually AML. And I did put it as AML, but I didn't want to say like, so what about the cervical lymphadenopathy? So I think, yeah, they give you the hint, so you would know this is lymphoid rather than myeloid, and they can give you sometimes, you know, question about mutation or yeah, characteristic cytogenetics. So it will guide you how to answer the question.
And another candidate says that by NHSBT, do you mean essential? In NHSBT, you have 3 courses for the trainees, and the non-trainee can also attend. Essential one is for ST3 level, junior level, intermediate, and pre-exam courses are for higher level of training.
Sorry to
Thank
add,
you.
Amir, the Red
Mhm.
Cell course as well for the, it's usually advertised for London trainee, but they can accommodate people from all the UK. If you can email them earlier, they will put you in a list. Their course is really helpful as well.
Who is doing this Red Cell course?
I think it's the South London Deanery, as far as I remember. But I have their emails. I can share it, and people they can email them. They will put
Yes,
you
if you
for
can
the
share
next call.
if you can share it in the part 2 group,
Yeah,
because
yeah,
I
will
have
do.
heard about this, but I learned that it's only for the deanly specific. If they can accommodate other people, please share it in the group so
I
that the
think
people.
yes, they did. I had a colleague from other deaneries, and they were accepted. So yeah, it's just I think they need a certain number of people around the country.
Yeah, I
And
think you
what
just
about
have to email them early.
yes? And what about practical hemostasis? How much detail we are supposed to know?
Not a lot. It's only the principle. I didn't waste my time knowing all the technique because I forget it the second day. So, and the exam question, it's mainly the principle. We got like, I think a single question, and it's a 1 mark or 2 mark. So don't waste your time going through the whole technique. You will be asked mainly about the principle. And I learned this from Amir, so I didn't waste my time knowing the details of each process, how to be done.
I have a question, sorry. And for the practical hemostasis, you are mentioning only principles. So, and so main principles of the main test, right? Because there is a lot of test over there, means for every part. For example, thrombophilia testing, and there is APS, and the the test we
Yeah,
can, because they are saying Laurel immuno latex latex
I don't think
immunoassay
so. No,
like that.
the
Yeah,
common
so
things. I mean,
like Dr.
APLS
Amir
also
is
it's one
always
of the
telling us.
common.
Yes,
Yeah.
DRVVT is the main one in the APS, then others. So the only principle, right? Because in I didn't see before the practical hemostasis. So before 2 days, I was looking at that, and it was too much stuff over there, too much. So if we
Yeah, actually,
I will go through it, it's take too long time.
to be honest, I didn't do practical hemostasis. I think I maybe I looked at one or two um, you know, tests, and that was maybe for part 1. So for part 2, what I would, it's too much, and you have a lot to go through. I think what I found helpful, Andy Godfrey had a very good lectures in HNT. So he had, I think, lab uh, um, hemostasis and clinical hemostasis, and he goes through all these tests, and that was what you need, just about the principles.
Thank you so much.
And what about Viva? One of the candidates is asking, shed some light on the Viva question, whether they ask definition or scenarios or causes of pathologies, how did you prepare, what to do?
I mean, I found Viva is the nicest part of the exam, to be honest. And times just goes very quickly. The question was really like practical questions. I can't remember exactly if I don't think they asked very detailed questions about definitions and things. It's like clinical scenario based. So it's very straightforward. I don't know how other people felt, but I felt this is the nicest part of the exam, and it was really straightforward, and I think everyone found it like that. I think the paper was a tricky part of the exam. but the viva is very straightforward.
Thank you so much, Razan and Sahla. Rofeda, do we have Rofeda online?
Oh, hiya. Hello. Yes, I'm here. Well, thank you
Yeah.
so much for giving me the chance. So I didn't make it this time. And I know I'm not that far, I won't be that far because I was studying with Sahla and Razan. I've started a bit late, so as Razan said, we started in January, so that's the prepping. So I think what went wrong with my preparation, I'm just very busy. I came on back of my maternity leave, but so I encouraged myself. I had the enthusiasm. All my friends are doing it, and I did it. And it wasn't a bad decision, to be honest, even though I failed. But studying with them was the best part. And I was only studying with them, so I didn't do like a studying on my own. I went back of maternity from my maternity leave in July. That's when I started work, and I was like trying to consolidate the knowledge at that time as well. I was studying with them for about 2 or 3 hours a day, and that we were very like doing it consistent and regular around that time. The only thing that I didn't do any practice at all. So that's what went wrong. The only even like when I signed up for the VSHAL course, I couldn't sign up for the UCLH with them because there was, I think I registered late. So I went to the abridged version of the VSHAL course. So I didn't do any of the papers. I only did the morphology, and I didn't do Viva as well. So the only Viva practice that I did was in our study group. I didn't do Vivas in your course as well. I did your mock exam, and that was the only mock exam that I did. And so I knew from that point is so I had knowledge, and it's true. It's only about I wasn't structured at all, and I think part of that is lack of practice. So being you've got the knowledge, you know it, but putting it into paper, pull it into point, pull it point, structure your answer, that comes with practice, and I didn't do that much. We did some of the mock exam in the virtual microscopy, Rezan and I, but that was like not timed, and it was just going through the answer. It wasn't like we writing the answer down, just like verbally going through the answers. And the worst part is the 3 days of the exam itself. I was so stressed because of I think when I did the mock, I realized that it's the practice that I'm missing. So I stressed myself even more. And the stress was my enemy in the exam. So I was reading question, I will go just black. I didn't write much. And I think it's not just the so I don't and I think I mentioned some irrelevant points as well. That one, the morphology wasn't tricky. It was okay. The transfusion paper was my I think my weakest point, and I haven't heard of the feedback yet, but I think that's what it's going to be. The coag, the questions, you either know it, as Rezan said, or you don't know it. So they were tough, difficult, but they are straightforward. But transfusion was very vague, and I missed the I spent the whole I spent a lot of time answering question one, which has like A and B, and in each of them had the division. I missed completely the B part. I didn't see it. It's just I flipped over second question, where is it? So I omitted that part completely. So it's very important, like, to read the questions very, very well. And I didn't do that at all. I didn't use the highlighter. So I was rushing through just like to finish. It was in the exam itself, I felt mid through I want to just leave because I was so stressed. I had it's physically I wasn't well. From the stress itself, that's the main thing. And even the viva, because I knew that I screwed the paper, I was so stressed. And between my two viva, I was crying. So they would ask me the question. I knew there were like transfusion reaction in the viva, so that was okay, but still I didn't get it. And I was just faffing around, not answering what they're asking me exactly. And I don't know why I did that, but I did it. Because I don't know, because in my mind that I don't have much practice, so that would definitely impact my the way I answer the question. I don't know, but this has happened to me, and I wasn't surprised that I didn't make it, unfortunately. So I think the prepping, everyone now said about it. All the resources are there. They're all good and helpful. Practice. That's what that's the key point. I didn't have the time to do the practice other than with my colleagues at that point. Yeah. So that's the main thing. Okay, thank you.
Yes. Any question, please, to Rufeda or to other candidate? Anyone? Any question?
There's a one question from I'm Sadia. I'm working as a clinical fellow in Southampton General Hospital. My question is, our work schedule is really, really very busy here. So I'm just a question for those who are working. How did you manage to arrange a time for study and for these courses stuff?
I can go
Maybe
for that.
Oshani can be the best person to answer this question.
To be honest, I am at King's and I was really grateful for my team. We have given the opportunity over the other colleagues as sitting the second part to have leave. So I have plenty of leave. I took my annual leave, the study leave, and the exam leave and the toil. So almost I didn't work on September. So that was really helpful. I tried to move all my own calls earlier. So I did my own calls and nights before September. And I think the rota and the team and the colleagues, they were quite supportive on doing that. So it will be your local team, really, how they are looking at the exam situation. So I felt really we were supported at King's.
Thank you.
Can I ask a question, please?
Yes, go on.
So you all agree that the blood transfusion was vague. So with vagueness of this question of transfusion, how can we overcome this?
It's a difficult question.
So is
Because
it
still
vague or
they,
just difficult?
I think, yeah, I mean, you do your part, studying well, preparing well, practice, and do whatever you can do with regard to the courses. And as I said, from the preparation itself, it's felt there is a gap because we are not practicing transfusion much in real life. So try to cover as much as you can from the guidelines from the NHSBT and give back. Always you will feel there is a difficulty in answering how to approach the transfusion questions. So we have a chance to discuss it with the transfusion consultant. She's one of the NHSBT. So if you had someone in your trust, part of the transfusion, you can ask them. They are excellent giving feedback. So I felt when we started, we are doing things that are irrelevant. So when they shed a light how to approach the question, it's make a huge difference. I think, yes, getting a feedback from one of the transfusion consultant will be very good because the transfusion course itself is very late. And then during your study with Amir, you can keep whatever. It's good practicing with Amir. And then you can write down. Sometimes you feel still there is a gap. You don't know if this is the right way to approach the question. Then you can take a notes and then you can discuss it during the transfusion course. with the BMSs or with the consultant from the NHSBT. They're quite helpful. At least you should have something to plan or to have a discussion about. If you go blank to the transfusion course, I think you might feel all over the way. But if you had like targeted questions you need to address, then you will benefit from the transfusion course.
Perfect. Thank you so much.
Any other question?
I have a question. Sorry, that in NHSPT course, what they are covering in pre-exam course means mainly they are covering everything from basic to advanced, and if you can book, so it's near exam, so we need to prepare before. There is mock type things, questions, or they are just teaching.
Sami, Oshani, Razan, Sahla, anyone can answer. Razan, would you like to answer?
Sorry, Amir, I wasn't listening. What was the question?
What they do in the NHSBT course? Is it a mock exam or it is just a teaching, or what happens in NHSBT course?
So it's very thorough. So they ask you at the beginning of the on a Monday, at the beginning of the on day one. I mean, at the beginning of the course, and they will ask everyone if you have anything you need a specific thing you want us to go through, and they will put all the people questions, and then it's very structured. So they have like a timetable for every day. So they go they give you lectures and sessions, and they go through things from basic to advanced, and also they do like some practice. They distribute people as the small groups, and then we do practice on that. So it's interactive. There is lectures. You will feel it's a lot, but it's quite helpful. I think yeah. So there will be a lecturer for almost everything, and there's a yeah. So it's a part of all. I mean, lectures and a small group sessions, and there's Viva practice at the end of the course as well.
So it is online? Is it
It's
online?
online. Yes, it is online.
Okay.
So you can
Okay.
join from outside UK.
So if you are a trainee, these courses are free for you. If you are a specialty doctor or outside the UK, then I think they will ask you for payment. Not sure about the specialty doctors in UK, whether they have to pay or not. But yes, if you're joining from outside UK, then I think you have to pay. Any other question? If no, thank you very much, all the host candidates, and we hope Profeda will make it next time. And she will join us again next time to advise the candidate. And this session will be. Mhm. Sorry, what did you say, Rafeda?
Well, thank you so much for that. Thank you.
Welcome.
Yeah, thank you
And
so much, Dr. Rusheda. It's very brave that bravely you said that you didn't make it.
Well, the main reason is that I had like supportive friends. So thank you so much to them and congratulations.
Advisors.
Yeah.
Thanks to you.
All the
Big
best,
thank you to
Professor.
Amir. You are doing a
And thank
great
you,
job.
Amir.
Thank you very much.
Yeah, I'm still registered, and it's 1 year left. And after that, I don't know whether they will continue or not. But
Thank you, Dr. Amir.
for the coming 1 year, I will continue these sessions.
Thank you, Amir.
Welcome. Take care, everyone, and have a nice Sunday. Enjoy.
Thank you so much, Dr. Amir.
Thank you. Thank you, Dr. Ahmed.
Thank you, Dr. Ahmed.
Thank you, Dr. Haem.
Welcome.